Hey Brainiacs, thanks for joining. Today I'd like to begin with a topic at the heart of everything we do as neurosurgeons, and that's focusing on patient care. Patients drive our desire to be better clinicians, scientists, and technicians, but fundamental to offering the best care is the ability to be a good communicator. I can watch a resident work through an operation with ease, but if they struggle to communicate with patients, it undermines our ability to offer quality care. It's a critical skill that must be developed and honed over time. Our ability to connect with our patients, the very people facing the prospect of brain surgery, is the most important first step in developing trust, rapport, and a solid partnership in their care. So in that vein, I want to focus on the patient perspective today and discuss the 5 questions every patient should ask their neurosurgeon. Number 1, what is your surgical philosophy? Every neurosurgeon, and really every surgeon for that matter, knows this answer intuitively, and their ability to explain that clearly and concisely is incredibly important. Understanding how they balance risks and benefits, and every operation has risks and benefits, in many ways reflects how they treat surgery. When I speak with a patient, I want to know what defines good quality of life for them, what their values are, what brings them meaning in life. The more I know about what my patients care about, the more I can tailor an operation toward mutual goals. So get to know your neurosurgeon better by asking him or her what their surgical philosophy is, and be comfortable with the answer. Compassion and safety are key. Set goals together and make sure you understand your neurosurgeon's expectations and what they hope to accomplish. Number 2, what is your experience with this type of operation? This essential question is an important technical one. Experience comes with time and case volume, or how often a neurosurgeon has done an operation, so be certain that your neurosurgeon has a background in the condition affecting you. Neurosurgeons have a variety of specialties, and many have taken extra years beyond their primary neurosurgery training and residency, a year or more known as fellowship, to focus specifically on their surgical area of expertise. So take that time to find an expert in the type of care you'll require. Your neurosurgeon should be able to provide a clear understanding of surgical goals, steps of the operation, and the risks and benefits of your particular case. No surgery is ever risk-free, and none of us is perfect, but an upfront conversation about their experience, expectations, and goals for your care is important to understand. Number 3, what can I expect during my hospitalization? Depending on your operation, you may go home the next day or spend days to weeks in the hospital. Understanding what your hospitalization will be like helps set expectations and offers reassurance during what can be a difficult time. No one likes being in the hospital, but you should be reassured that your neurosurgeon will be keeping close tabs on you during your recovery. It's also important to know who is part of the care team and who will be primarily responsible for your care. Are residents, physician assistants, nurse practitioners, or students involved? What limitations could you have? And what does a typical recovery look like? Number 4, what can I expect during my recovery? Just like understanding your time in the hospital is important, it's always good to ask about when your neurosurgeon thinks you'll be discharged home and how your recovery will go. Many of my patients, even those for whom surgery is a complete success, will require a stay in a rehabilitation facility where daily physical, occupational, and sometimes speech therapy can be given. This can be an important early step to maximize your recovery, but some patients are fine going straight home. It's also important to discuss the medications you'll need to take, for how long, what restrictions you'll have on your activities, if any, and when you'll start feeling better. Sometimes recovery takes just a few days, but oftentimes it can take up to a full year to recover from brain surgery. The brain has a surprisingly high capacity for recovery, and understanding how to improve and speed up your recovery should be a topic you discuss with your neurosurgeon. We can't always predict outcomes in advance, but you should have a general sense of the possible paths you may take as you heal from your surgery. Number 5, how can I reach you if I have more questions? Now, I've seen this time and time again. You leave your doctor's office, and 5 minutes later, more questions pop into your head that you wish you had asked. When facing brain surgery, it shouldn't be difficult to reach your neurosurgeon. While my policy is to give out my cell phone to all my brain tumor patients, even just an email address, secretary's phone number, or office line should be given to you. It's completely normal to need reassurance, have further questions, or need directions clarified, and having direct and quick access to your neurosurgeon is important in whatever form they prefer. Now, don't get me wrong, our hours can get incredibly demanding, and so it's not always possible to return a message the same day or even the next. But you should feel like your neurosurgeon is accessible and available and able to communicate with you if you have more questions. So those are the 5 questions you should ask your neurosurgeon. Leave your comments and thoughts below. I'd love to hear what questions you'd want to ask, especially from those who have gone through brain surgery and can offer advice for people facing that too. So thank you, fellow Brainiacs, for joining. I have plenty coming on the horizon, so keep an open mind, and I'll see you next time.